Good sound? Okay. So how many are pre-dental? Angela is. Angela is actually a student in the program, and she's been to my office multiple times. We work out a time that was best for her schedule. This semester it was Tuesday afternoons, so she comes in Tuesday afternoons, kind of hangs out with me. I explain a few things that we do and try to show her what dentistry is all about, and she gets to see me interact with patients. My patients are pretty willing to accept a stranger in the office, and it's worked out well, don't you think? Okay, so there was another pre-dent over here, so there's a couple. Okay, so I'm going to just tell you a little bit about myself. Thank you for having me back this year. Was anyone here last year? Okay, so some of this may be review, but I just want to talk to you about who I am, where I come from, what motivates me, my background, and things like that. A little personal information about myself. I went to the U of I. I graduated in 1983 and a half. I went to an extra semester, attended no summer school. I had to work the summers to pay for school, so I graduated in December. And the best part about that was Illinois went to the Rose Bowl that year, and I went, so it was all worth it. So I'm pretty orange and blue. I met my wife in undergrad, and we dated through the end of undergrad and through dental school. We got married in the middle of dental school, in the middle of my sophomore year. At Christmas break. We got married on December 21st, so that was in dental school terms. Anyone that's been through dental school knows that that's halfway through your crown and bridge class. It's one of those stressful periods of life, so why not throw any more stress and get married? So I have 4 sons, and once again the orange and blue comes through. My oldest will be 25 tomorrow. He's actually graduated with an ME degree here from the U of I. That's mechanical engineering. And he's actually getting a master's degree in fire protection engineering in Europe, so he's studying this semester in Sweden. Andrew graduated, it'll be a full year. He's working for an engineering firm out of Houston, and he's actually working in Wyoming right now at a oil refinery. So he likes it out there. He's bought his cowboy boots and a pickup truck, and has bought 3 guns. So he's enjoying life right now. And my 3rd son is a sophomore at the U of I. He's also studying mechanical engineering. And he's actually on the football team. He's one of the long snappers, number 56. So everybody has season tickets, right? Right? Because you'll find me there with my 56 jersey on. I couldn't be more proud. My 4th son is a senior at Centennial High School. He is, I don't know, brainwashed, but he is attending the U of I next fall in biology. Yes. So there's hope. He says he wants to study marine mammals, so we'll see where that takes him. So he is coming to the U of I, so I'm 4 for 4 with my kids. I'm really pleased. A little bit about my practice. My practice is, I consider it to be a very personal place, a very friendly place. I try to get to know my patients on a daily basis. I have an advantage. I see my patients at least once, twice a year. If they need a procedure, I see them, they have to come back. So I get to see them and talk to them on a regular basis. I'm a general practice. I see children, I see adults. I have a large population of geriatric people, so their needs are different than what an 8-year-old will need. I like the variety. I like the change. If you're doing the same thing every day and you don't get to know the patients, it gets kind of dull. So I enjoy getting to know my patients, and I think it pays off in the long run. Would you say that I'm pretty friendly with my patients? And that's why when I offer, this is Angela, she's a student at the University of Illinois. Do you mind if she comes and watches? And they're like, sure, no problem, because my patients trust me, I guess, so they must trust Angela. Okay, I bought a practice 24 years ago. I had looked for a job in Chicago. I was from Champaign. I grew up here. I wanted to come back. And I didn't find much in Chicago, but I did have an opportunity to come to work for a dentist in Champaign for about 6 months. After that 6 months, there was a dentist who was retiring, and he was selling his practice. I had the opportunity to buy his practice, and I took over. So I'm in private practice. I don't have any partners. All the decisions I make are my decisions. My choices are my choices. That's good, that's bad. You could be a dentist that works in a partnership. You could be in a group where you share facilities, you can share equipment, you can share vacation time. That's important. When I leave my office, I leave my office. It's kind of awkward for patients, so I have other dentists cover for me. But if you're in a group practice, if you want to go on vacation, usually your partners will cover for you. It's kind of a done deal. You could be in managed dental care like Aspen Dental, and there's some other places like that a lot of young dentists will come out and work for those companies. And there's incentives for people to come out and do that. I personally like the path I've chosen. My staff is relatively small. We all have specific jobs. I'm the dentist. I have a full-time assistant. Pam's been with me since for 24 years. She was with the dentist before, and she's been with me chairside the whole time. I have a full-time licensed hygienist, and she does all of my prophylaxis, my cleanings, my x-rays, and that type of work. I have a full-time receptionist. She does all my she checks the patients in, checks them out, she sets up appointments. She does some of the billing work because she receives the mail and the insurance payments and all that stuff, so she does that for me. What makes my office a little unique is my wife, Karen, who I've been married for 28 years, is part of my practice as well. She works, basically Tuesdays and Thursdays she comes to the office, but she does a lot of work at home. She's kind of my CFO. She does all my finances. Okay, so she will pay the taxes, she'll do the payroll, she'll pay all the stuff that goes out. She also pays my bills. We order supplies through manufacturers and certain supply companies. So she pays attention to what's on sale, and she buys what we need, and she buys what she can when it's on sale. So she kind of does all that. So in her position, she can do this at home as well as the office. And when you had 4 children at home when they were young, it was important for her to be at home. And it worked out well. So like certain evenings, every other Wednesday, she's doing payroll. So I have to leave her alone upstairs while she's working in the office. Okay, so that's how my family's kind of set up, and that's how the office works. So you may be asking, how did I get here? Okay, I had interest in high school that I thought, what am I going to do? So one of the things I really like to do is I like to work with people. I like to be personable with people, talk to people, and so I thought I wanted something that I could converse. I really enjoyed using my hands. I grew up making balsa wood airplanes as a teenager. We didn't have video games at the time. I was always doing something crafty or making or painting or coloring or something as a kid. So I wanted to use my hands. I liked medicine. I liked medical documentaries. My father was a pharmaceutical rep, and medicine was part of our lifestyle. He would talk to doctors on various occasions, and sometimes I was there, sometimes I wasn't, so I saw that. I have an uncle that was an oral surgeon, and I knew what he did, and I liked what I saw. And I have an older cousin that was also a dentist. So in my family, there was just these little, influences in my life that I thought, well, maybe this is something for me. So I went ahead and applied to school. I applied to the U of I got in. I went in and studied biology. To be honest, my first 2 years in undergrad, my grades were average, nothing spectacular. I'm sure you've all had a class where you have to take it over, redo it, whatever, drop it, pick it up again next semester. I did that. I did what I could to get a good GPA. At the end of my sophomore year, I decided this is where I want to go. So what do I have to do to get there? So this is what I did. I really buckled down. My grades improved. My grades substantially. There was a huge improvement between junior and senior year. So I showed progress there. To get to dental school, you needed an aptitude test. We had the MCAT today taken by 2 students. Same thing. You have to take an aptitude test. So I took it. I scored a little bit above average, and I thought, this isn't going to cut it. It's competitive to get into these schools. So I thought, all right. At the time, I took a Kaplan course to study, and I used my money and my time, and it paid off. After I studied and took the exam, my scores were much improved. They were well above average, and it really looked good. So now I had good scores, and I also had my grade point showed big advance. So it looked like I knew what I was doing. The other part of you want to be able to shadow a dentist, and that's what Angela's doing at my office. My dentist in town worked in a building where he shared an office. He had a partnership. And so I could see him work and I could see his partner's work, which was a good way to see two people working at the same time. Across the hall, there was a pediatric dentist, and that's what I really thought I wanted to do, is work with kids. And that was a good thing. I enjoyed looking and watching him work, but at the same time I thought, I like all the other ages of people. I like the older patient, the younger patient, and everybody in the middle. So pediatric dentistry kind of lost its favor with me at that point. And at the same time in that building, the other component of dentistry is knowing dental materials. You're not just cleaning teeth and filling teeth. You need to know more about materials. So in that office, they had a lab technician in the basement. So I could see the dentist do the work, prep for the crown, take the impression, and send it to the lab technician. He was in the basement. I could go down there and see what he did. Because when you go to dental school, that's half the battle. You have to know your dental materials, and you do the lab work in dental school. So you have to be able to be prepared to spend hours or whatever working in the lab, manufacturing whatever you're going to do. In dental school, when I went to dental school, you had to make all your own crowns and bridges. You couldn't just take the impression, send it to the lab, and miraculously in 7 days it comes back and you're ready to cement. Everything was done by the student. So that's how dental school was very different from the real world. And the other thing is you need a letter recommendation. And this is something that you guys can be working on right now. The letters of recommendation, I think personally, as a professor, I've written letters for other people. It's hard to say something nice about somebody if you don't know them. So it's your job now to find that professor you like. When you sit in that first day in the class, you think, okay, I really like this guy. He's pretty good. You need to get to know that professor so that he knows you. So when he's writing that letter recommendation, he's not just creating a generic letter. Because somewhere that letter is going to end up on a desk somewhere, and you want that letter to pop. You want that to stand out. So either you work in his lab, you go into office hours, you say, can I meet you for coffee? I'm having troubles with whatever. You got to know that professor. So that's something you could be working on with every class, or whatever professor works for you, okay? So I applied to 4 dental schools at the time in the state of Illinois. Northwestern has since closed. Loyola, which was in Maywood, has since closed. University of Illinois at Chicago, and Southern Illinois and in Alton. And I got accepted at all 4, and I had to choose where to go, and that was easy because the state of Illinois, U of I, and Southern were both public schools, and the other 2 were private, and the finances were just unbelievable when you talked about those numbers. So I chose the University of Illinois at Chicago. One, it was closer to my girlfriend, and that was important. Instead of being 7 hours apart, we are now only an hour and a half, so it made a big difference. Dental school, do you want to hear about dental school, how it differs from med school? Okay, this is for me, it may have changed. My first year in dental school, I shared a roommate. I had a roommate that was a 4th-year med student and a first-year med student. And so Ed, the first-year med student, he would just go to class, take his anatomy class, his micro class, and his histology class, and study and go out every night. And I thought, well, I couldn't do that. Dental school was different. We were learning the basic materials the med students were learning. We were doing anatomy, physiology. We were doing micro, biochem, histology. We were learning everything that was normal. But at the same time, we had to learn all the dental stuff. We had to learn the dental materials. We had oral anatomy. We were focused on that. We had to know what impression materials were made out of, what stone was made out of, what a porcelain's made out of, what gold alloys we use, what's a silver filling made out of. We didn't know all those things. So I spent much of my time studying while my roommate was going out. So that was different. Sophomore year, you learn everything that's abnormal. You learn pathology. You learn pharmacology. You learn about systems of disease, cancers, and things like that. So sophomore year, you've learned what's healthy. Now you're learning what's sick, and then how to fix them. Okay. 3rd year and 4th year are clinical years. You're mostly in the clinic all the time. You still have lectures. You go over materials that pertain to dentistry, prosthodontics, which is like replacing teeth, endodontics, which is root canals, periodontics, which is like gum disease, oral surgery. So you spend more time in dentistry, still learning other things as well as clinic time. So Monday, Tuesdays, Wednesdays, and Fridays were all day in clinic. We had an 8 o'clock lecture every morning, and then we had clinics all day. There you scheduled your patient just like you would in a private practice. That patient comes in, you perform the procedure, you're scored, evaluated, and graded. all the way through. So they don't hold your hand, they just watch your hand. So then, as far as getting a license out of dental school, after the end of your second year, you take a national board. It's a written exam. Once you pass the national board, then you wait for the second national board. We'll take the first, then take the second, midway through senior year, for your fourth year. If you pass that, then you're license eligible. And then once you've taken and passed those two national exams, then you decide where I want to practice. I want to practice in Illinois. Then you I took the Northeast Regional Board, which was this territory here and all up to the Northeast. So it was like Massachusetts and New York and Vermont and Maine and Connecticut and Pennsylvania. And the funny thing was at the time, Indiana and Wisconsin were not included in that area, but Michigan was. Doesn't make sense, but whatever. So that's kind of what dental school was all about. At the time, I wasn't interested in going on to oral surgery school. I wasn't interested in becoming a periodontist. I didn't want to do endos all day. I wanted to do general practice. I liked comprehensive health care. I liked to know what the patient needs and try to treat them as their whole body. So there are programs across the country at large teaching hospitals, and they're called GPRs. So it's a general practice residency program. They are not required. It's an elective year that I decided to take. So it was an elective year where I was a resident working as a licensed dentist inside the hospital. So I applied to several schools, and I matched at Loyola Medical Center. So there, I liked the emphasis that Loyola had. They had a large heart transplant unit. They were doing bone marrow transplants for the first time. We saw people that were going to have like a heart valve replacement, and the cardiovascular surgeons would say, we're not going to replace this person's valve if they have a bunch of bombed out teeth. So they would have to get a dental exam. So we'd bring Mrs. Jones in, sit her down and said, Mrs. Jones, you have these bad teeth. They need to come out. Well, this person was really sick because they're in the hospital waiting for a new valve or bypass or whatever. And so we would have to work within the hospital, either take them to the OR, sedate the patient, remove the teeth, and move on. And being at a medical center, we also were part of their emergency team. So when there was dental emergencies that came in the ER, they'd call us at 3 o'clock in the morning or whenever, and we saw those cases. We didn't do a lot of trauma. I don't want to be an oral surgeon. I don't want to do a lot of trauma, but Loyola fit for me, so that's why I went there. There were other hospitals that were doing different things that I didn't care for. And so besides doing dentistry, we did a rotation through internal medicine. We did a rotation through anesthesia. We did a rotation through oral surgery, and we did a rotation through ear, nose, and throat. I love that rotation because Loyola did a lot of head and neck cancer treatments. All the head and neck cancers went to the ENTs. And so we got to see them. Those doctors liked us because we knew the anatomy. We got to scrub in on cases that normally we wouldn't because we knew what they were talking about. We knew what they were taking apart. So that's why I did Loyola. I loved Loyola. It was a great year. I learned a lot. I learned about how hospitals work. You know, they're 24/7. They don't care what holiday is. They're on. And if you guys are going to med school, that's the way it's going to be, 24/7. Okay. That's basically it. Do you have any questions? Right?
We'll do questions.
Okay. I just want to say that dentistry is changing. This is, I guess, what I did and went through. But my point is there's things that are going to change in dentistry, and they are changing. Technology's changing. We have digital x-rays. We have digital impressions. We have CEREC machines, which actually will mill a crown and make the crown while the patient waits. There's technologies that I have in my office, technologies I don't have. There's reasons why I don't, because of maybe cost or money. So there's a lot of things going on. There's research done in all kinds of things, a lot of tissue regeneration. Your oral surgeons and your periodontists are trying to regrow bone graft procedures, put bone where people don't have it, because we do so many dental implants now. You can't put a dental implant into a space where there's no bone. So how do we make more bone? So we're working on that. How do we grow back gums, tissue, gingiva? There's techniques available to do that. So the point is, it's growing, and there's new technologies and things are available. Cosmetic dentistry is out there. Some people want to have that perfect smile, and people focus in on that, and that's what they want to do. That's fine. Some dentists are doing Botox treatments. I mean, it goes on and on and on. So there's a lot of dentistry out there. It's changing. Technically, it's still the same. You still need your hands to make it work, because without your hands, it's not going to happen. So you've got to be skilled and know the best for your patient, and you've got to be a caring individual, because a lot of people come in, some people are nervous, anxious, and other people are like, whatever. And, so you have to be able to be flexible and work with your patients. Thank you.